Okay, we're back, we're live. You know, it's, my God, what day is it already? It's Tuesday.
Yeah.
And that means
5th.
it's Hawaii, the state of health, okay? With the state health department. You guys are here from the state health department. We're calling this show The Role of Public Health Nurses in the Department of Health and the Community. I've always wanted to know about this stuff. But the problem is, it's changing all the time. So today we'll get a snapshot of what's happening. Melissa Sarahina, public health nurse. That's a special designation.
Yes, it
You
is.
probably have a name tag somewhere that says that.
I do. I have a
Oh,
name
there
tag
it is.
right here.
Can I borrow this? Melissa Sarahina, registered nurse and State of Hawaii Department of Health.
Yes.
And you're in Waipahu Civic Center.
Yes.
That's your base of operations.
That is my base
I
of
don't see-
operation.
Oh, too bad. That's Sherry Kukona. She doesn't have her badge with her. So.
It's in my bag.
I'll vouch for her. She's okay.
All right, we'll take that. So Sherry, tell us how you got to be a public health nurse.
Oh, okay. Well, you know, I entered nursing school.
Here in
and-
Hawaii?
Yes,
At
at
UH?
University of Hawaii in Manoa.
Yeah.
Yes, and
Mary Boland.
yes,
Okay,
yes,
got it.
yes,
Yeah.
yes. And you know, we go through all the different programs of nursing. So different classes. We have community health nursing. We have medical surgical nursing, and then we have pediatrics, psychiatric nursing.
All these are different kind of nurse specialties.
Yes,
then,
so every semester we enter one of those programs, and of all those programs, community health is what jumped out at me. This is what I thought, this is what I wanted to do. I wanted to work in the community, working with children, with elders. You know, I enjoyed my rotations in the hospital, but that's not really, that wasn't me. I wanted to be out in the community working directly with people, because I've always, the concept of primary prevention is always what I liked. Having to work in the hospital and giving medications and all of that, that was a good experience, but it was more important to me to be out in the community educating people and hopefully preventing
You're a
them from...
people-oriented person.
Yeah, yeah.
You wanted to touch
Yeah.
people,
Yeah, so
But there's also, it's more than that. It's when you're in the hospital, the patient comes in, you see him for a couple of days,
Right.
he leaves.
yes.
In the community, it's not like that?
No, it's not. I mean, you go into the homes and then you basically build a relationship with them. And, you know, you find out what's going on, what kind of services do they need. You hook them up with whatever services they need, because we know what agencies are out there, what services those agencies provide, and we hook them up with the appropriate services, and hopefully they can get the services that they need. And we're just there, basically, sometimes we're just a sounding board.
A lot of people need us when it comes to health.
Right, yeah, and so we develop relationships with our clients.
You know, they say, when I was practicing law, you know, they say, real estate is not about land, it's about relationships.
Yes,
So,
it is.
You could also apply that to many other things, including public health. It's not so much about health as it's about relationships. Put them in touch, hook them up. Yeah, that's great. So, was it like you thought it would be?
It was slightly different. When I was in school, the public health nursing rotation that I went through, even back then, like 8 years ago, public health nursing was pretty different, wasn't it? Not too different, but I guess in my rotation, we did a lot of school health and home visits as well, and that is still what we do. But I guess what I didn't see when I was in school was all the community work that public health nurses do, and it's a lot of community work, working with different agencies, developing health and wellness programs. We have a few examples we can talk about later. Yeah, so, but it's all been very great experiences. I actually come to work and I don't hyperventilate before work. I used to work in a cardiac unit, and some days I would have to sit in my car. I'd sit in my car and hyperventilate before starting my shift. But I come to work and I'm all smiles, and yeah.
Yeah, well, that's great.
Yes.
Yeah.
That's what you went to nursing school for in the
Of
first
course.
place. You wanted to help people.
That's
Yes.
right.
Yes.
Looking at the community for
Okay,
sure.
Melissa, you know, so now it's your turn.
Sure.
You decided at some point this is what you wanted to do. What were the factors to that decision?
Well, you know, I had an opportunity to actually do my nursing at the Leeward office, the Leeward PHN office when I was in school. And so in doing that, I really found my niche, working with people, making that connection. Like Cherry said, working with the different programs, and every day is a different day. You never know what's gonna come to your desk. You just gotta be ready to go and
You know,
think on your feet.
It's different than a doctor, I think. A doctor, my observation, I'm just an ordinary patient person, but a doctor is surrounded with formality, with staff, and paperwork, and it's not like you walk in and say hi.
Right.
You can't do that.
No.
No doctor, unless he's your uncle or your brother or something. But with a nurse, you're much more accessible.
Yes.
And I mean, that's probably good and bad, but for you, I think it's probably good because you want that.
Right.
You want them
You
to.
want that connection.
You want them to have that connection. Yeah.
Correct.
And you want to give them that access where they can come and find you anytime, and you
Right.
can help them anytime, and you're available to help them anytime.
Right,
Yeah.
right. As nurses, we're able to adapt to the needs of the community.
Yeah.
Yes.
You're not saying that doctors don't adapt. No.
Well, I'm not saying that. We're talking about nurses.
Okay.
Yes.
Okay, so what is it like in a given day? What do you do?
Oh, a given day. So.
You don't hyperventilate at all.
No, there's times where you do. Well, like Cherry said, we actually work with different programs. We work with the DOE schools. So a day could look like you have to go out and maybe do some emergency action plans at the school, train the teachers on a specific condition, for example, like asthma. Then another thing, you could be collaborating with a program and working on a health and wellness piece to be included. Yeah, so it can be a very busy day.
Yeah.
Yes.
So how far do you go in the direction of practicing medicine? I mean, for example, I was telling you I got this call from HMSA, which I really appreciated a lot, where they say, you know, we're part of the health and wellness program,
Okay.
which sounds like a new concept. I don't think this was around 10 years ago. And we want to have contact with you between your appointments at the doctor. And so we want you to call us, and we'll call you, and we'll have this regular communication. And if you have a problem, you'll tell us, and we'll give you some advice about where to go, what to do. And you know, that's remarkable. This never existed before. And I don't know about you, but I've noticed that, as I said before, doctors are less accessible in the last several, you know, decades. And now, so this fills the gap. I think you guys are part of the same thing, filling the gap for wellness, for lots of reasons. Am I right?
Yes.
Yeah.
Yes.
So what is a health and wellness program, at least as far as you're concerned?
What is a health and wellness
Yeah,
program?
Yeah. Cherry used that term to start.
So actually, we do work with different providers in the community. So for example, we are working with the Kapalana Traveling Preschool, and they actually provide educational services to the houseless population and the at-risk.
Did you say houseless?
Yes,
Okay.
homeless, houseless.
Got it.
Yes, the houseless population. And basically, we have been collaborating with them to see how we can create a health and wellness program, particularly for their staff as well as their participants. So we collaborated together and developed what we call the Kapalana Toolkit. And basically, that included very basic health information that anyone can use. And we were looking at targeting health literacy, right, and wellness into their program.
It's funny, a lot of people don't really know about health. I'm not sure why. Do you know why? You know, you find people who are perfectly educated, sentient people, but they seem to have missed out on being educated about their own health.
Well, there's a difference between having functional literacy and being able to read. There's health literacy, and basically being able to read that health information, understand it, and make the appropriate decisions for your health.
stakes are high.
Yes,
So you help them with that.
yes.
You give them the materials, you ask them to read the materials, and you ask them if they have any questions. And
Right.
then you come back later and ask them again if they had any questions.
Well, the thing is, when it comes to working with our families and our communities, we want to make sure when we're going in that we truly know their health literacy level, right? We understand, okay, so maybe they have English as a second language. Maybe they can't read, they don't have functional reading. Educational level, maybe they graduated or they didn't. They only went up to the 8th grade. So you really have to look at how they learn.
Yeah.
And so when you go in, you might take pictures,
Yeah.
right? Versus something written,
Yeah.
right? Or a video.
Yeah.
So they're able to understand.
Wow, you got to be a psychologist and a sociologist too.
We
You have
wear
to really
we wear
know
many
those-
hats. Yes, we do.
So, okay, so then you say, you know, I was joking before, but I have this pain right here, okay? We're doing a case study now.
Okay.
I have this pain right here. What do I do? What do you do?
Well, we just do our nursing assessment first. How long have you had that pain?
What happened?
And what happened? See if
How did you get it?
Somebody punch you, maybe?
Right.
Okay.
Yeah, so we try to just ask, you know, what happened? What kind of pain is it? Is it sharp pain? Is it dull? Is it come and go? Is it constant?
Rated.
And,
Mhm.
Right, and,
Yes.
you know, have you seen your doctor?
Answer no.
Right,
Yeah.
and
Then what?
And then,
At that point, you don't have a doctor. You haven't seen your doctor. Do you have health insurance?
Oh, that's really good. All those good questions.
Yeah, I mean,
And
we
you
have
don't know
to.
exactly what answers you're going to get
Yeah,
either.
so we really truly have to do a comprehensive assessment to see what that individual needs.
Yeah.
Right.
Yeah.
Yeah.
Okay, and so you might find, for example, this is something obvious.
Mm-hmm.
Maybe it's black and blue. Somebody hit him in the face yesterday. Who knows what?
Right.
And you can make sort of a putative type diagnosis. What do you do then? I mean, so you may or may not know, but you think it might be this and that. What do? You refer them to a doctor. Do you treat? Do you give them bandages?
Well, if they would need a bandage, but we would recommend, again, we would do the assessment, and from there we would decide, okay, hey, what next steps are we going to take? Are you going to see your physician? Should we call? And hey, let me talk to the nurse or the doctor. Hey, we're with so-and-so. This is what we see. Where do we go from
You're
here?
an advocate too, then.
Correct.
Oh.
Ooh, you're
Both
really
of you,
getting.
you're an advocate too. Okay.
So we just don't, yeah, we need to look at everything. As public health nurses, we look at everything comprehensively to ensure our clients, the community, they get what they need.
Okay.
Filling in those gaps, like you said.
So you palpate his face and it feels like the bone is broken right there.
Uh-huh.
And you send him down to a doctor or maybe an emergency room, depending. Okay.
Mm-hmm.
Now they do something. I don't know what you do, but they do something.
Okay, he
maybe
got treatment,
treatment,
okay.
something, and now he's back. He's back a few
Right.
days later.
Right,
You get to see him again.
yes.
How does
Because you
that come
wanna,
about?
yeah, so you wanna make sure that if there was any type of surgery or any type of treatment recommendation that was given to him or her, that you wanna make sure you go through it with them. What do you need to do? How do you need to take that medication? How do you need to apply that ointment, right? What is it used for? So it's really making sure they understand what they need to do to care for themselves.
This is a mitzvah. You know mitzvah? It's Yiddish. It's a blessing. It's a good deed.
Yes,
That's what it
public
is.
health nurses, yes.
Because otherwise, he wouldn't know.
Right,
Otherwise, the chances are as good that he'll make a mistake and make it worse, or not get better soon enough, and
right.
all that.
And then hopefully in the future, they're able to care for themselves, right?
Yeah.
Because you're building on that. You're building their education and understanding of their condition.
Yeah. Now, are you going to see him in your office or at his place?
No, at his place,
Really?
yes.
Place of work, place of residence.
Place of residence, or
Okay.
wherever they feel comfortable.
you have an appointment with him, you're gonna
Yes.
follow up with him.
Yes.
He's on your calendar.
Correct.
You're gonna go find out what happened to the guy.
Yes.
Yeah. All right, we're gonna go find out what happened to a break. We're gonna take a little break here. We're here in Hawaii, if you didn't know, the state of health. And we're talking about the role of public health nurses in the Department of Health and the community with Melissa Sarahina and Cherry Kukona. And we're having such an educational experience.
Yes,
I'm feeling better every minute.
Good.
We'll be right back.
Aloha, my name is Josh Green. I'm a senator from the Big Island. I work in the ER there. But on Tuesday afternoons, I get to come and spend 45 minutes to an hour with Jay Fidell and the ThinkTech staff. They're terrific professionals. They help us to bring some of the leading cutting-edge topics here across our state to you. So you can join us at our show on healthcare in Hawaii to talk with leaders from across all the spectrum of health in our state, or you can join us for any other show where we talk about economic development or tourism or some really eclectic programs too. So really, we'd love to see you here on our show. Thanks for joining us and thanks for supporting us.
Aloha, my name is Miley Scarpino and I'm the host of the Empower Hour. If you're interested in health, nutrition, fitness, here on the island of Oahu, want to learn more about places to train at or different trainers available, then watch my show on Fridays at 3. We have a great time and I hope that you'll come join us. Much aloha, now go get swole.
Right, but it's a big
Okay,
difference.
we're gonna go back
Oh,
now.
okay.
We are back.
Oh,
How come you didn't tell me that?
oh, no, I didn't
Okay,
know.
We're back, okay. I'm Jay Fidell, this is ThinkTech, and we're talking about community matters, because community does matter. And we're talking about the role of public health nurses in the Department of Health and the community here in Hawaii, the state of health. Okay, and Melissa Sarahina at my left, and to her left, Cherry Kukona, both public health nurses, and they both have credentials to show. So you
We
mentioned,
do.
you both mentioned at some point in the discussion about the houseless and the homeless. Big problem, you know, and every time I see in the paper, you know, there are 4,937 homeless. I say, how do they know that? Is there any way to know that? And how about the people that got to be homeless in the last 20 minutes?
Right.
How do they know that? You guys are on the cutting edge with that and trying to help them have reasonable lives in their condition. But first, you know, you had an interesting philosophical distinction between homeless and houseless, and I'd like you to tell us about that.
Okay.
You did too, Jerry. I want yours too.
So we were sharing with Jay about the terminology, the difference between homeless and houseless. So when you say houseless, someone, the individual or family basically doesn't have shelter over their head or a house. When you say homeless, it comes from the heart. People really look at home as a place of love, as a place of peace. So
You can have that without having a house.
yes,
Yeah, and you had an interesting
Yes.
twist on it about the Hawaiian people
yes,
who feel they're at home
Right.
wherever they are.
yes.
Because this is home. This is Hawaiian land.
Yeah.
And so you can't, to just say homeless. They are home. This is home.
Right.
And so they are not homeless. They're just houseless
Yes.
without shelter.
For me, for myself, I believe that we're not doing enough for them. That we have to do much, much more. And if we don't do it, it's a shame on us.
Right.
So the question, the point that I would make, just gathering from this conversation, is that this is one way where the state of Hawaii is actually doing something hands-on. You're
Yeah.
going out there
Outreach.
affirmatively. So tell me how it works. How do you go? Where do you go? What do you do to deal with, to treat with, to give comfort to the homeless, houseless? How does it work?
Well,
You
one
go
of-
out on Tuesdays?
No, not so much like that. But like Melissa mentioned earlier, Kapalana, we work with them a lot. And so it's partnering with agencies that are already out there and providing, supporting them and providing them with that health, if their program doesn't have a health component, we help to provide that health component to their program. And then we do have individual cases. We might have a referral from someone, or some of our nurses do case finding, within these populations, and so we'll find cases there, and then in those cases we'll do one-on-one, or we'll take on a family as a case to follow.
So now you have a file, essentially, on this family. You have some concern about the health of this family, and you're going to go back and talk to them again and again, make sure that they're okay and that they're getting reasonable health care. Is that what it is?
Yeah, you're going to meet them where they're at. So, for example, you know, I've had families that lived on the beach, and basically I would do my home visits there, but eventually getting them connected to the emergency shelter, and then eventually to transitional, and then low-income housing.
They're friendly with you. They accept you. They appreciate you.
Yeah.
Maybe more than they do others.
Well, because you want to build a trusting relationship.
Yeah.
Yeah, like we said, relationships are so important.
Yeah. So they probably have a series of ailments that come from being houseless because they're outdoors all the time. I don't know what that would be, but I imagine there's a subset of things that happen to them. And you have some idea going in that, you know, that might be the case. What kinds of things do you find?
Well, first, when we go in, of course, like Cherry said, we want to do that assessment.
Yeah.
So what are the needs at this moment for this family?
Yeah.
And that at that point, we start connecting them to the resources that they need.
Yeah.
And then hopefully, once we get everything together and we've worked with the family and they've actually are engaged with trying to have that better lifestyle. So it does take time, and you just got to go with where the family's at.
That's really remarkable. And you know where they are. I mean,
Yeah.
you know where your clients are.
Right,
your
you want to know their
patients are.
story.
Yeah.
Yeah,
It's all about that,
Yeah.
isn't it, story?
truly.
So you get to know them. They become even more than strangers.
Yes.
And I mean, this could last for years, no?
Yes,
You could know them as the kids grow up. You could know them through the thick and thin.
right. And then you can know their kids and the generations. Yes.
And you can keep them, I won't say keep them alive, but you could keep them balanced, keep them relatively healthy. What's the interconnection, the intersection between that and health insurance and all that? When you find somebody homeless, presumably have no money.
Right.
So how do they get health insurance, if at all? And how do you get them treated if they don't have health insurance? What is it, always an emergency room thing or what?
No, it's not an emergency room thing. So what we do try to do is if they don't have insurance, we try to get them signed up. We have this great program right now. We're connected with the Pacific Gateway Center, and they are actually one of the healthcare connector programs.
Under the Obamacare?
Correct. So they actually come to our offices and they provide that service on getting people signed up for medical insurance. So yes, so we try to do that, and then at that point, once they do get connected, and then they do need to choose a physician. At that point, we get them connected to their physician, and hopefully, once they do that, they can build that relationship with that medical home. So we truly look at getting everyone connected to a medical home.
Right. So and then they deal directly with the medical home, or
Correct,
they deal through you?
correct. Well, they'll deal directly with the medical home, but we'll help them with that transition. Because sometimes we may need to go with them to their appointments, because they may not understand what's going
That's beyond
on.
the call. Maybe it's not beyond the call
Yeah.
for you guys, but it's
But
going a long way.
If you truly know the needs of your family or the community, you're going to do what needs to be done.
Yeah.
So you may need to go with them, make sure that they get connected, make sure, again, they understand what they need to do to take care of themselves.
Yeah.
So you're truly really building that individual, that family, and that community.
Yeah. Well, so do you ever actually, take blood pressure and inspect people in the eye and the ear and open your mouth with a little wooden stick, that kind? You do that too?
Well, at the
When
home,
do you do that if you're a public health nurse?
if we have a client, we can do that, our assessment in the home, or we do it on a larger scale for screening.
Is this a special category of nursing that's provided for in the law? Is that what it is? I mean, but where are you seen? Are you the same as a registered? You are.
Yes.
A
You read
registered
mine?
nurse.
Yes.
Yeah.
Yes.
So it's all the same, or is it different?
Okay. Well, yes, we
You're
are.
passing the tough ones over to Terry.
Well, I don't want to be the only one talking.
No, I mean,
It's okay.
we are, we're all licensed registered nurses. So there's just different fields of nursing. So you have the acute care nurses who work in the hospital, and even then there's different types of nursing, right? There's pediatric nurses, there's maternity nurses, ER nurses, and then you have the home health nurses.
Oh, that's the kind of come when you're
Yeah, when
getting old.
Right, they are
Okay.
not necessarily old, but if you need
You
skilled
have to
nursing
stay at
services
home.
at home,
Yeah,
right? They
okay.
come and visit you and they provide services there. And then you have, nurses who work in doctors' offices. But then there's Department of Health nurses, public health nurses. But so all different types of nursing, all different specialties. But we all have a registered nurse license
Okay.
and follow the same nursing process. It's just that we apply that nursing process differently depending on the population we're serving and the setting in which we provide the service.
You have more freedom, don't you? You have more discretion. You're out there on your own, right?
Yes, there's a lot of
You can
independence.
decide
So,
who you want to see.
well, we don't decide who we want to see.
Who decides who you want to see?
Well, we do our nursing assessment
Okay.
to determine the needs of the client.
Yeah.
Yes.
Yeah.
So from what Cherry was saying is, yeah, you have all different types of nursing, but public health nurses truly look at the health of the public across the lifespan.
Oh,
Yes, it's across the lifespan. So there's infants, school age, you're elderly. So yeah,
so that means
so
that
it's a
I know
general
you guys
practitioner.
now, and we're bonded then.
Yeah, we're bonded
Yes.
Yeah, for life.
for life.
It's going to be longer for you than me, but for life.
Okay.
So, but if you run into somebody in your travels, then that person is somebody that you can, or maybe should, or will follow and check it out. Like the woman who called me from HMSA. She wants to know every week how I'm doing.
Right,
So, it's a great way to do wellness because then
right,
people don't fall off the side so quick.
right.
No.
And they can identify things at that moment, right? And what's
Yeah.
going on in your life. Any type of, maybe you're feeling depressed or,
I was
They can-
going to ask you about that. I mean, if you're dealing with people who don't have regular doctors, who don't have houses sometimes, you probably find a lot of people who are depressed and who maybe
Mental
have,
health.
serious mental illness sometimes. How do you handle that? Because that's something you wouldn't see if you were practicing in an ordinary, doctor's office or hospital setting. You wouldn't see that nearly as much.
right, right. And we do encounter those situations.
You
And
train for it? I mean,
Yeah,
sometimes it's hard to know
Yeah,
what
and
you
it's
got,
sometimes
know?
that you might be in situations where you need to de-escalate, be
Yeah,
calm,
yeah.
and
I know you're being calm now.
yes,
You know that?
yeah. But and really understanding how to handle yourself as a nurse in those situations. Yes,
Yeah. So then you have to talk them down.
yes,
This could be a whole street scene, actually.
yeah.
You could be the one. You
yeah.
could be the one at the
Yes.
frontier, so to speak.
Right,
You could be anywhere. That's the thing about public health.
right.
You represent the state, actually,
Right.
in the community,
Right.
in all parts of the community.
We're an expansion of the Department of Health.
Yeah, and
Yes.
you bring health to people that the
Right.
ordinary health establishment does not reach.
Mhm.
So that must give you a certain level of gratification. Does it pay well?
Yeah.
Would you be making more money in the regular medical community?
I
I think it would depend. It just
Yeah, it
depends.
depends, but we're just happy with what we do.
That's right. You do it
You
for
do
the
it,
psychic
yeah,
benefits.
you do it for the love of public health nursing,
Yeah,
yeah.
okay.
for sure.
When we come back, I want to talk about, not love, but kind of love. I want to talk about organizations
Okay,
of public health nurses and how you get to see your peers and colleagues
okay.
and how you sort of come together within the organization.
Mhm.
Okay? We're going to take a short break. I'm Jay Fidell. This is Hawaii, the state of health. talking about the role of public health nurses in the Department of Health and the community with Melissa Sarahina and Cherry Kukona, both public health nurses. We'll be right back.
Hi, I'm Ethan Allen. I host Likeable Science on ThinkTech Hawaii, and I do this because I care about science literacy in Hawaii. I want to spread the understanding that science is a vital and interesting part of everyone's life. I want to make sure the broadest possible spectrum of people understand the beauty and the value of science and realize that science plays out each and every day of their lives. I want you to understand that science is fun. So we bring onto this show each week guests who are scientists, from astronomers to zoologists, and we talk about what they do and how they do it. But most importantly, we talk about why you should care about their work, why you should see that their work has value and impact on your life. So I hope you'll join us Fridays, 1 p.m. here on ThinkTech Hawaii. You can watch us via live stream. You can watch us recorded on Olelo, and you can see us each week. We hope you'll join us.
Okay, we're back, we're live. We're in the last segment of our show on the role of public health nurses in the Department of Health and the community here in Hawaii, the state of health, with Melissa Sarahina, public health nurse, and Cherry Kukona, public health nurse. So yeah, I just wanted to sort of get the larger landscape, the group in general, public health nurses, the force, if you will.
Right.
Okay, you say there are 100 statewide, and
Public
they're
health
on
nurses.
all islands, or most islands, I guess.
We have 11 PHN offices statewide.
Okay, what's a PHN office like? What's in it? Is it got an operating room?
No, no, it doesn't. Basically, it does have clinic rooms, because in the past, public health nurses would do screenings. They would do they would actually help the physicians in doing physical examinations. Yeah.
Are there public health doctors too? No.
Public health doctors.
You know, the doctors that you would be screening for, I mean, that kind of thing.
Well, that was back in the past.
That was back in the, I
Yes.
remember I was
Yeah.
in the federal government.
Yeah,
We
that
had
was back in the
public health.
past.
I mean, a public health service,
Yes.
federal public health service.
Right.
But you don't have that. Yeah.
No, because now we have MedQuest, right? And
Yeah.
then now we recommend going to a medical home
Yeah.
where you can get all your needs met
Yeah,
there.
so you are
Yeah.
the front line.
Yes.
Yeah, okay. So 100 statewide, and in each office there's what, 2, 3, 5, something like that?
Depends. You have offices that have about 15 nurses, and then you do have some offices that have about 6 or 8 nurses, depending.
Okay.
Yeah.
So, you know, where is it going, do you think? I mean, one thing I will offer my reaction is that it's going more to you. I told you this before. It's going more to you guys. You are the front line. You offer medical care to people who might not otherwise have access to medical care. You are more like doctors every day, but that's the way the whole medical profession is working. It really is. I mean, it's no secret there. And, you know, where do you think it's going from here? You've both been with the organization for a while. You know, you can see the sea change. What is the sea change?
Well, I think now it is going back to community, where it started off at. So
Old Hawaii style.
yes, community, and at one point it did focus more on that hospital, the hospital type nursing, but now it's definitely going back to community, because that's where
That's what you're
things
talking
can.
about, going out to see people,
Right.
engaging with them in their place.
Well, yeah, so the voice of the community and community involvement is just so crucial, because that's how you sustain communities
Yeah,
and their health and their wellness.
yeah. But as you know, it's more than that. It's you
Yeah.
are the state government. You are reaching out.
Yes.
You are making a message to
Yes.
people that the state
Yeah.
cares about them
Yes, yes.
and wants them to be well.
Right.
And that's a huge
Yeah.
message.
We're the voice of the people.
You are, and,
Yes.
and you may be, you know, think about it, who else in, you know, in the state, in the Fed, actually does that? Hello, I'm your friendly public health nurse.
Right.
I'm here to help you. I'm from the government, I'm here to help you. And you really mean it.
Right, right.
Yeah, well,
So.
that's a good thing for Hawaii. This is
Right.
this is a great program.
Right.
Yeah. So I wanted to ask you also about how this affects people on the other side. Do they appreciate this, what we're talking about? I mean, you say community, and that kind of assumes that they do, but how do they feel about you? Do they send you flowers at Christmas?
You know, we have a good relationship with our communities, with our providers, also with the different federally funded clinics. Yeah, so we do. And I believe they do appreciate what we do
Yeah,
as being the link,
yeah, oh, that's true.
yeah, to the community.
So what about, as I mentioned before, what about getting together with other members of the public health nurse force? Do you have a training program or a program in which you all get together and compare notes on what's out there? How's that work, if at all?
Well, we do have a chance to meet annually to see what's going on with the other sections and the other neighbor islands. Also, we stay connected with the different groups that we have. We have an elderly group, breastfeeding group, and so forth. So that's how we truly stay connected in what's going on.
You have resources. I mean, for example, you run into this fellow with a problem in his face. Saying, I don't know what to do about this. Can you email or call someone and get some advice about that? How does that work?
Well, in that particular case, we would most likely just refer him to
See a doctor.
see a doctor. Maybe one of the clinics, federally funded clinics, if he doesn't have health insurance. Yeah, but for other situations, like if there's a breastfeeding mother who needs resources, we might refer her to WIC or other breastfeeding agencies, or or for an elder.
So you make the call on whether you best
we help to
treat
connect
it.
them, right?
You know, a few years ago, HMSA, this is reminiscent, HMSA started a program online. I don't know if this is something that, your constituency can afford. I mean, to have a computer, but but there was a program online, and some guys from out of town developed this program, and the idea would be is you would go to a doctor, not your doctor necessarily. It could be, but not necessarily. And you'd say, I'm feeling a funny pain in my face, whatever it was. And the doctor would be there. You'd see him, his video
Online.
of the doctor, and you would ask him questions, and he would come back to you. And he would go only so far, though, because after a time he would say, look, I can't feel the face myself, so you're going to have to go see someone who can feel the face.
Right.
But that went away. That went away. The HMSA doesn't do that anymore, as far as I know. So the question is there room for that in what you do? Do you see that in the future about where, you could be in your office and somebody can contact you and have this conversation? I know it's not the same level of relationship,
Yeah.
but have this conversation online.
Yeah.
Maybe it's not part of the deal that the ethic, of the style of the
Right,
public
the
health
style of
nurse.
nursing, for sure.
You guys are really hands-on.
Right, we're really out there in the community. So, I mean, good idea, but
It didn't work the last time.
yeah, I think it would take away from,
Yeah.
That building
Yeah,
relationships,
a
that
connection.
right? And that's one of the biggest parts of what we do, is having that relationship with a family, because you can only do so much. You can tell somebody to do something, but if you don't have that relationship with them to understand why they haven't been doing what they were told to do, then going back
You're
and
never
telling
gonna
them,
find out.
right, going back to telling them the same thing, they're not going to do it still. So you need to go in, find out what's going on, what are the barriers, and then work with them to overcome those barriers so that they do follow through with their treatment plan.
So it's trust.
Yeah.
Yeah, they got to trust you. And you got to trust them
right,
to tell you.
right. And it's finding that root cause. What is truly happening?
That's like, what do they call it? Design thinking. You know what design thinking is? Problem solving in general. They probably have it in the nursing industry just as well. And what the guy presents to you, you never accept that per se, because you always have to be satisfied that it isn't that or that or that. You have to sort of ask what it as you just said, you have to ask what it really is, and only then can you get about solving it. You have to be, because sometimes people can't tell you, they don't tell you, and you have to unzip them and make them tell you.
That's right.
So
Peel
maybe
away the
that's a
onion.
big thing for you guys, because you're dealing with a population that may not be willing to tell you. Do you ever reach, active resistance where the patient says, I'm not going to tell you. Who are you anyway? I'm not going to,
Right. I've had resistance.
Yeah.
But it was just taking the time and being there and being consistent. Whatever's happening around them, the PHN is consistent. They're always there.
Demonstrating your, willingness to care and help no matter what.
Right.
I mean, does the resistance ever get physical?
No, I've never
you-
experienced
no,
anything
no.
physical.
They know it at some
But
level.
at the
you're there.
end,
Yeah.
once you build that relationship, they don't want you to go.
Right.
They're like, oh, are we done?
Yeah.
You're doing what you need to do. You're taking care of yourself, you're taking care of your family. So it's time to move on.
Do they want you to see their friends and neighbors? I mean, if they like what happened, do they refer you to someone else and then you get a call from someone else?
Sometimes they do. I mean, I had a gentleman, a client, and then he's like, "What about my wife?" So I ended up taking her as a client as well.
Right.
Right. But there does need to be. I mean, when we take on cases, they have to. They do need to have a medical need to have a public health nurse. So unfortunately, we can't take on every single case. But
So when you say medical need, you mean they're sick in some way?
Yes.
So you have to, that's the first parameter. You can't just,
For carried cases, yes.
for what kind?
For carried
Carried.
cases,
Yeah.
Yes.
for cases that we follow. In general, with all the community projects, it's anyone and everyone. But for cases that we actually follow, there are some parameters as to who we can take on as a case.
It strikes me also that because you are at the front end and talking to people and, figuring out what the condition of the community is health-wise, that you have valuable data there, and that through you, there can be an examination of how we're doing here in the state, demographics, surveys. And do you do any of that, or do you have any programs that are running along those lines?
So we do that. Everything we do, we want to make sure that we're collecting data to see what our impact is on the community. So we want to make sure when we do something, we want it to be sustained.
Sure.
Right. You just want to do something just
Shape
to do
it
it.
for the future, make it more efficient.
Right.
Yeah.
Yes. So yes, data is very important.
So you're feeding it back, somebody is presumably doing stats on it, and then you learn by the success, and I suppose the unsuccess too.
Right.
So in the minute we have left, can you tell me about a case that sticks in your mind that you really liked? No names.
Okay. So a case. All right. So when I actually first started, that was 10 years ago. I had an opportunity to work with a family that had an autistic child. And so at first the family couldn't accept it. They're like, why is this happening? Why is it happening to my family? What's happening to my particular child? Why are they different? So we truly had to go through the process of understanding, accepting, educating, and getting that family to a point where they were able to understand, navigate how to care for their child, how to get them through the day, what that day would look like. It's not easy. It's not easy because they require routine. They require you to truly pay attention and getting them through whatever they that day or whatever they're going through. So basically, at that point, the family was able to become very independent. And actually now, I just found out that they are now advocates for autistic kids.
Good.
So as you can see, that level of learning, understanding, and
Really
really
understanding,
built,
yeah.
and really built that family to a point where now they're advocating
Yeah.
for other kids.
Yeah.
So really sustaining that in the community.
Yeah. This does bring to mind the notion that in every family where there's caregiving involved,
Right.
you have to train the caregiver.
That's right.
Because caregiving is not easy, and it requires huge sacrifice as to the rest of the life of the caregiver. You know, I know people who, you know, have had fabulous careers, and at some point their spouse fell off somehow, and then they made a decision, I don't know if you see this often, they made a decision that they were going to dedicate the rest of their lives to be caregivers. It happens, and there's, you know, no alternative, and they accept that. So have you had an experience you want to forget? One that didn't work out so well?
No, actually.
You guys love your work, eh?
I mean, there are
You learn to
there
work
are,
through it.
Yeah, there are always little hiccups here and there, but nothing ever so bad.
Okay, well, I suggest you keep on doing it then.
Yes.
All right. That's Melissa Sarahina and Cherry Kukona, public health nurses, both totally dedicated. It's wonderful to have you working the community this way. It makes a better place for all of us. And this is the role of public health nurses in the Department of Health and the community here on Hawaii, the State of Health. Thank you very much, ladies.
Thank you.
Thank you.
Aloha.